Welcome back to another edition of the DAMY Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. Today on the show we're talking about long-term health and the physical aspect of long-term health. You know, there's no point in talking about longevity if we're not speaking about the physical health, the physical body. Commonly when we're talking about longevity, we're talking about reducing the risk of disease and disorder. So we're talking about reducing cardiovascular risk, which is heart attacks and strokes. We're talking about reducing cancer risk and Alzheimer's risk. But you know, when we can't skip out on the physical body, because one place where people rapidly go downhill when they've taken care of all of these different areas is with bone breaks and with chronic pain. These two things can be such torture long term, and bone breaks shorten lifespan significantly when you hit a certain age. Like in elderly people, if you break a bone, your risk of death is high from then on out. So it's just really hard to recover when you don't have the resources. So if you're dealing with osteoporosis, it's important to get ahead of it. So the two things we're talking about in terms of longevity and physical medicine, number one is posture. Posture is extremely important. When you're dealing with pain, it's important to, if you don't know the cause, or if it's chronic pain that is injury induced, you want to make sure that your day-to-day posture is on point. The most common experience in for poor posture for people currently is the shoulders rolled forward and the muscles of the back elongated, specifically the rhomboids, and weakness in the erector spinae. So the muscles that align the spine, they can get really weak. So the muscles of the chest and the shoulder get really tight with sitting, with sitting a lot, and with just kind of the activities of daily living that we experience. And with this rolled shoulder posture, the rhomboids become tired and weak, and the erector spinae of the thoracic spine become weak. So what we have to do is we have to do the physio to open up the chest, and we have to stretch out the anterior muscles every single day, and we have to strengthen the posterior muscles. We have to strengthen the muscles of the back. So lots of videos on YouTube for how to do that. I'm not going to go through that today. There are good ones that explain Supermans and how to actually challenge the muscles of the thoracic spine. So just review YouTube on how to do that. But the point of it is, once you develop a protocol, whether it be Supermans or rowing, or the other one is external rotation of the shoulder, then you have to stick with it, and you have to get stronger and stronger as time goes. And then at the same time, you have to go through the stretching protocols for the anterior muscles. So you have to take the chest to the door and stretch to the side. You have to stretch the shoulders out in all different directions, and you have to make sure the muscles of the anterior body are elongated and the posterior body are strengthened. And over time, posture gets better and better, and it's easier and easier to sit up straight with the shoulders rolled back. It's really important because chronic pain can happen quickly with poor posture. So make sure that's taken care of, and you know, don't skip out on the physical therapy. If you're already in the position where you feel like your shoulders are rolled forward, consider the physical therapy, give it a try, and do it for 8, 12 weeks and see how the results come at that point. Don't just give it a few days, because it won't do much. It takes time to get stronger, and I would suggest volume training for these back muscles. Like, you know, just do the motions that are available for the protocols on YouTube, and just hold them. Just hold them for a period of time, and try and hold them for longer and longer as you get stronger and stronger. And give that a try, and over time you'll notice that strength difference, and you just naturally will have a better posture, and that will reduce your chance of having chronic pain long term from the upper thoracic side of things, which is very, very, very common, especially with the cell phone usage nowadays. We've got cell phone neck coming in, which is CT junction dysfunction. I didn't mean to rhyme that, but that's excellent that it did. A CT junction dysfunction is when you have this head down, chin down, typing on your phone type of posture for long periods of time. It's also a shoulders forward posture, but it's really stressful where the neck meets the back, and that can get inflamed. And we've seen some crazy cases in our clinic of inflammation at that CT junction, just big red upper backs. And you've probably seen dowager humps around. It's when people have a little bit of fat tissue that have developed over time there. We're seeing that more and more often now because of this cell phone usage. So checking with posture. And the second thing is the prevention of osteoporosis. You know, it's important to get your vitamin D checked. It's important to make sure that you're meeting adequate requirements for calcium, D3, K2. But if those are all on point, if you're eating well and your vitamin D is normal, then you got to challenge. Either way, you have to make sure you're challenging the bones long term. You don't have to lift weights, but you need to move your body. You need to move all areas of the body. So you have to exercise the upper body and you have to exercise the lower body. And because the real point here in the prevention of complications of osteoporosis is that the muscles that are attached to the bone need to be strong, and you need to challenge those bones through exercise, and that will make the bones strong, and that will keep them strong. That'll allow the body to say, hey, we need to lay calcium down here. We need to keep this thing strong because it's being challenged so frequently. So prevent fracture at all costs. Keep those bone scans, keep those bones strong by getting bone scans done, getting DEXA scans, and tracking to make sure that there's either no loss or some improvement. We've got some studies, the study for AlgiCal showing improvement, but it seems like we can maintain things with calcium, and then the injection Prolia is not a bad drug either. So it's a rank ligand inhibitor that seems to be beneficial for most people who do it, and with very few side effects. So I'm okay with Prolia, but I'm interested in AlgiCal because of the study showing improvement in bone density. But sometimes we're doing AlgiCal or calcium in general, D3, K2, and then if it's really bad, we're doing Prolia injections at the same time. Well, I'm not doing them, but the specialists are doing the Prolia injections, and we're seeing benefit with that whole protocol. So I like that too. But you got to exercise. The point of the video is to say that you got to challenge the bones. Got to make sure that we're challenging them frequently. And like I said, it doesn't need to be weights, but it needs to be all areas of the body. So whether it be push-ups and sit-ups and plank and pull-ups and climbing and squats and lunges and all of these different exercises, really, really important for keeping the bones strong long term. That's all I wanted to speak about today. I don't talk about physical medicine much, but because we do cold laser therapy here in the clinic, we see a lot of pain and inflammation, and we spend a lot of time talking about osteoporosis, osteoarthritis. We see a lot of rheumatoid arthritis, which is different, but we do a lot of postural therapy. So trying to go through the physical therapies required to improve posture long term and therefore reduce chronic pain. And it's pretty good. It's pretty good in combination with cold laser, because cold laser can adequately suppress pain and inflammation in most tendon injury, muscle injury, joint pain and swelling. So anyways, it's a good protocol. We like it. That's all I want to touch on today. Make sure that you're keeping pain down and keeping your body mobile and fluid, doing lots of stretching, doing lots of movements. Stay as mobile as possible for as long as possible. Thank you so much for watching. Hope you have a great day. Hope you have a good weekend. Thanks for tuning in. Bye.